Hi everyone, this is Simran. Welcome back to our Denial Management Learning series. In this session, we will talk about CO-96, non-covered charges, one of the most misunderstood and costly denials in medical billing. Many AR callers see CO-96 and immediately assume the claim cannot be paid, but in reality, many CO-96 denials are fixable. If you know what to check first, by the end of this video, you will clearly understand what CO-96 actually means, why insurance companies mark services as non-covered, and how an AR caller identifies whether the denial is correct or incorrectly applied as non-covered charges. I will also explain which documents you need to review, the payer logic behind this denial, and when you should follow up and when you should not. So, before you write off another CO-96 denial, let's start with the most important question. What is CO-96 non-covered charges denial? CO-96 is called non-covered charges denial. It means the insurance company has rejected your claim because the service you billed is not covered under the patient's specific insurance policy. In simple words, the insurance company is telling you, we are not responsible for paying for the service you performed or billed. Why? Because from the payer's point of view, the service you billed is not allowed, not included, or not covered under the patient's insurance policy. Or it violates the insurance contract rules for payment. That is why the insurance company denies your claim and does not make the payment. This type of rejection is called non-covered charges denial, and in short, we call it CO-96 denial. Now let us uncover the exact reason why the insurance company rejects your claim as a CO-96 non-covered charges denial. There are three main reasons why your insurance company rejects your claim as a CO-96. Reason 1. The billed service does not match the insurance benefit requirements. This denial usually occurs when the service you billed does not match the insurance benefit requirements. For example, maybe the diagnosis you billed does not support medical necessity. Maybe the service you provided requires prior authorization, but you did not obtain it before providing the service. Or maybe the provider is out of network for that insurance plan. Sometimes it can also happen because you billed the wrong place of service. So, whenever you see this type of denial, the first thing you should check is, did the billed service meet the payer's benefit requirements or not? The second reason for the CO-96 denial is that your benefit limit has already used. In this case, your service is covered by the insurance. But the problem is, you have already used all the allowed benefit limits. For example, let's say the insurance allows only 3 physical therapy visits per year. But you have already used all 3 visits. Now, if you bill for the 4th physical therapy visit, the insurance will deny the claim as CO-96 because the benefit is covered but the allowed limit is already exhausted. Reason 3 for a CO-96 denial is that the service you billed is not covered under the patient's insurance plan. Some insurance plans do not cover cosmetic procedures, certain alternative therapies, or specific drugs. When you bill for a service or procedure excluded from the patient's insurance plan, the claim will be denied as CO-96 non-covered charges. I hope you have understood what CO-96 means and why insurance companies apply it. Now let's learn how to resolve the CO-96 non-covered charges denial step by step, like an expert AR caller. Step 1 is identify the exact denial reason first. So, before taking any action, you must identify which type of CO-96 denial it is. Ask yourself 3 simple questions. 1. Is this denial due to the insurance benefit requirements? 2. Is the benefit limit already exhausted? 3. or is the service completely excluded from the plan? Until you identify the correct reason, never appeal and never write off the claim. Your next step is to review the explanation of benefits, EOB. Whenever you see a CO-96 denial, the first thing you should do is carefully read the EOB. Check the CPT code and diagnosis code and confirm, is it a valid code or not? Along with this, also check the remark codes or denial description given by the payer, the allowed amount, the patient's responsibility amount, and the adjustment reason. Once this part is clear, the next step is to check the patient's eligibility and benefit plan. Now open the patient's insurance eligibility or benefit verification and carefully check and confirm whether the billed service is covered under the patient's insurance plan or if it is excluded. Verify the number of visit limits and check whether prior authorization is required for the service or not. Also confirm the provider network status, whether out-of-network services are covered under the patient's insurance plan or not. This verification clearly tells you one thing, whether the CO-96 claim denial is due to the insurance benefit requirements, the benefit limit already exhausted, or the service being completely excluded from the patient's insurance plan. If the CO-96 denial is correct and it happened due to the insurance benefit requirements, then ask yourself 4 questions. Was prior authorization required for this service? Was the diagnosis code correct and properly supported? Was the provider in-network at the time of service? Was the place of service billed correctly? If your answer is yes and proper documentation exists, then you can proceed with submitting an appeal to the insurance company for reconsideration. While submitting the appeal, make sure to include medical records supporting medical necessity, correct diagnosis coding, authorization proof if applicable, provider contract reference if required by the payer. If prior authorization was required for the denied service, it is important to understand how insurance plans treat authorization requirements. Many insurance plans mandate prior authorization or a provider referral for specific procedures before the service is rendered. When this requirement is not met and the payer's policy clearly states that services without authorization are considered non-covered, the insurance company will deny the claim as CO-96, non-covered charges. In this scenario, do not file an appeal because the denial is valid as per payer guidelines. Follow the client's policy strictly, either transfer the balance to patient responsibility or write off the charges as instructed. However, if the payer allows retroactive authorization, you should attempt to obtain it and then reprocess or resubmit the claim accordingly. If the diagnosis code does not support the billed CPT code, the insurance company may deny the claim. In this situation, the CPT code may be covered under the insurance plan, but the billed diagnosis does not support medical necessity. When the diagnosis code does not justify the procedure, or when it does not meet the payer's medical policy criteria, the payer may deny the claim as CO-96, non-covered charges. In this scenario, do not submit an appeal until you fix the diagnosis issue. If you correct the diagnosis code and proper documentation is available, submit an appeal with the required medical records. If it is not possible to correct the diagnosis, then transfer the balance to patient responsibility or write off the charges as instructed by client policy. If the place of service was billed incorrectly, the insurance may treat the service as non-covered. Insurance plans allow certain services only in specific locations, such as an office, outpatient hospital, or ambulatory surgical center. If you bill the wrong place of service, or if the service is not covered at that location, the payer may deny the claim as CO-96, non-covered charges. In this situation, do not file an appeal immediately. First, verify where the service was actually performed. Check the medical record and confirm the correct place of service. If you can correct the place of service, submit a corrected claim with proper documentation. If the service is not covered for that place of service, transfer the balance to patient responsibility or write off the charges as instructed. If the benefit limit has already been used, understand this clearly. When your billed service is covered under the insurance plan, but the allowed number of visits has been exhausted, the insurance company will deny the claim. For example, an insurance plan covers only 3 physical therapy visits per year. If the patient has already used all 3 visits and you submit a claim for the 4th physical therapy visit, the insurance company will deny the claim as CO-96, non-covered charges. In this case, an appeal will not work because the benefit limit is already exhausted. The denied amount becomes the patient's responsibility, and you must follow the client's policy to either transfer the balance to patient responsibility or write off the charges. If the service is clearly excluded from the patient's insurance plan, such as the provider is out of network, the benefit limit has already been used. The service is statutorily non-covered. The insurance plan clearly states no coverage. In these situations, the denial is valid. Do not file an appeal. Follow the client's policy strictly. Transfer the balance to patient responsibility or write off the charges as instructed. These steps help you avoid unnecessary appeals, reduce rework, and ensure proper AR resolution. Now you clearly understand what CO-96 actually means, why insurance companies mark services as non-covered, and how to resolve CO-96 denial cases. Now let me share a very simple formula to resolve any type of non-covered CO-96 denial in just 3 minutes. Just remember this formula. If the service is covered and you have followed all contract and payer rules, you can submit an appeal. If the service is covered but the benefit limit is already exhausted, the balance becomes patient responsibility, or you can bill the secondary insurance if available. But if the service is not covered under the insurance plan, you must write off the charges or transfer them to patient responsibility as per client policy. If you remember this formula, you will never feel confused about CO-96 denials again. If you want to master claim denials and grow as an expert AR caller, this playlist is for you. I teach 30 plus of the most common medical claim denials step by step with job-focused techniques, no theory, no confusion, only real payer logic and real AR workflows you can use immediately. Follow this playlist to read denials correctly, fix them properly, and stop them from coming back. This is how real denial management skills are built. Subscribe to this channel. If you want job updates and hands-on training material, join my WhatsApp group, link given in the description.